one of the questions that I got asked the other day was, why is it that some drugs are easier to get off of than other drugs? Aren't they all, if they cause addiction, isn't it all the same? And I would say there's a part of it that's the same, and that has to do with in the brain, where there's a common pathway, what we call a neural circuit, that is affected. That's how we know that some substances can cause addiction and others generally don't. However, in terms of how addictive something is, or the effects, the physical effects that it might have on somebody, and psychological effects, they do vary. So for example, if you are drinking alcohol in excess and have high amounts that you're drinking for a long time and your body is very dependent on it, if you were to stop it, what they call cold turkey, right? Just stop it. You can actually run the risk of dying, of having a seizure and dying. Same thing from medicines that are what we call sedatives in the class called benzodiazepines. Those can be very dangerous to just stop. They're also potentially very addictive too. Now, if we're talking about, say, a marijuana, well, that's probably not going to happen. That doesn't happen. And so the effects that one has from withdrawal, once they stop it, are variable depending on the chemical. One that actually is not going to usually be life-threatening, but probably one of the most difficult to handle from the standpoint of withdrawal, are coming off of opioids. And opioids are pain medicines usually, but also when they're illicit, they're heroin, and there are other types of pills that can be found and extracted from, related to morphine. That class of medicine causes a withdrawal syndrome that is very uncomfortable for people. And that's also what makes people continue to use. It's actually a logical thing in some ways. If I feel horrible from the withdrawal, doesn't it make sense to make the withdrawal go away? And that answer is of course. Of course, we always seek to not have pain, right? And so how do we do that? Well, if you have an addiction and you're dependent and you have withdrawal, if you use the substance again, guess what goes away? All of the withdrawal. You get to feel normal. Now, one of the most misunderstood things about addiction is that people think that people that have addictions are just trying to get high. And I'm going to tell you that very quickly in the course of the disease, it is not about getting high. It's actually about not getting sick. That's a completely different thing to move you. It's to not get sick. That's what they're trying to do. And that every drug has its own fingerprint in terms of how addictive it could be and also how difficult it is to get off of it, and the consequences that might go with that on one side can cause death, and on the other side can just be, well, merely uncomfortable for a few days, okay? But it's, they're also not the same things as it relates to the chronic part. So if you drink alcohol or use tobacco, those are generally things people do for a long time, for decades, right? Decades. And the injury that happens inside of your body happens over short periods, over long periods. Whereas sometimes, in the case of, say, an opioid, if somebody smokes heroin and that heroin has fentanyl in it, well, that could be the one and only time they ever use because they might die that time. So how dramatic something affects you in a short period is another variable between the different chemicals.